The gold standard of medical research, the randomized controlled trial, has been taking a bit of a beating lately. It's the topic of this week's Healthcare Triage. We just did an episode about the limitations of the method in studying effectiveness, and effectiveness is what we care about in real-world situations. But the randomized controlled trial remains a powerful tool. It's still perhaps the best method for conducting explanatory research. And in past episodes, I've recounted numerous times when hypotheses from observational studies, those based solely on observations of particular groups, have failed to be confirmed by a controlled trial. Perhaps the greatest strength of the randomized controlled trial is in combating what's known as selection bias. That occurs when groups being studied, intervention and control, are already significantly different after they're selected to be in the intervention or not. One of the most elegant examples of why we need such trials came recently in an examination of employer-sponsored wellness programs. These programs are usually offered by employers to make their employees healthier. They can offer screening for a variety of reversible conditions, access to weight loss programs or gyms, encouragement and support, and sometimes even chronic disease management. Many of the analyses of these programs have shown positive results, and we've covered them in previous Healthcare Triage episodes. Almost all of the analyses, though, are observational. They look at programs in a company and compare people who participate with those who don't. When those who participate do better, we tend to think that wellness programs are associated with better outcomes. Some of us start to believe that they're causing better outcomes. The most common concern with such studies is that those who participate are different from those who don't in ways unrelated to the program itself. Maybe those people participating were already healthier. Maybe they were richer, or didn't drink too much, or were younger. All of those things could bias the study in some way. The best of the observational studies try to control for those variables, but even so, we can never be sure that there aren't unmeasured factors, known as confounders, that are changing the results. Confounding is a classic problem of selection bias, so perhaps the best way to be sure that the two groups aren't different is to remove selection from their hands by randomly assigning participation. But that's hard to do with a wellness program, especially since they are put in place for an entire company usually. It's expensive, and it requires a lot of time, and there's no clear funder who might want to sponsor it. That is until recently. This year, researchers published results from the Illinois Workplace Wellness Study, a large randomized controlled trial of a wellness program at the University of Illinois in Urbana-Champaign. Almost 5,000 employees volunteered to participate in the study. More than 1,500 of them were randomly put in a control group, which basically received no services. About 3,300 were invited to receive a biometric health screening and an online health risk assessment. They were then offered a number of wellness activities, including classes on weight loss, exercise, Tai Chi, smoking cessation, financial wellness, and more. They were even offered financial incentives of various amounts for completing screenings and participating in activities. Of course, not everyone given an opportunity to engage in such activities will take it, but more than half of those offered the program participated. The researchers followed everyone in both the control and the intervention groups for a year to see how the program affected their activities, their health, their productivity, and their medical spending. The results were disappointing. There seemed to be no causal effects. Here's the nerdy fun part though. In addition to this analysis, the researchers also took the time to analyze the data as if it were an observational trial. In other words, they took the 3,300 who were offered the wellness program and then analyzed them the way a typical observational trial would, comparing those who participated with those who didn't. The results were very different from those of the controlled trial. If we look only at the intervention group as an observational trial, it appears the people who didn't make use of the program went to the campus gym 3.8 days per year, and those who participated in it went 7.4 times a year. Based on that, the program appears to be a success. But when the intervention group is compared with the control group as a randomized controlled trial, the differences totally disappear. Those in the control group went 5.9 times a year, and those in the intervention group went 5.8 times a year. Researchers looked at whether people participated in a race, like a marathon, a 10K run, or a 5K run. The observational analysis, comparing non-participants with participants, showed a significant difference in participating, 3.3% of people versus 9.2% of people. But the randomized controlled trial, on the other hand, found 6.5% versus 6%. Wellness programs sometimes claim to save money by reducing healthcare spending. The observational analysis supports this belief. It found that participants spent significantly less than non-participants on healthcare, $525 versus $657, and on hospital-related costs, $273 versus $387. The randomized controlled trial, though, showed that wellness programs had little effect on spending compared with the control group in both overall spending, $576 versus $568, and hospital spending, $317 versus $297. The researchers even looked at the percentage of people who left their job for any reason. In the observational analysis, 15.4% of non-participants did so compared with only 7.2% of participants. It appears from such an analysis that wellness programs are associated with retaining workers. But the randomized controlled trial showed that no such causal link exists, as 12% of the control group exited the job versus 10.8% of the intervention group. Why such stark differences? Julian Reif, one of the study's principal investigators, said, and I'm quoting, "The most likely explanation is that participants differ from non-participants in very important ways. Therefore, when a wellness program is offered, the differences seen between those who take advantage of it and those who don't are due to differences in the people rather than differences from the program." Often the best we can do for an observational trial is to adjust, control, researchers say, for variables we can measure and that might also affect the results. These researchers did. In one analysis, they controlled for sex, age, race, salary, and status as faculty or staff, and they still found that the results of the observational analysis were significant for all the outcomes discussed above. In an even more heavily controlled analysis, they used machine learning to decide whether to control for even more variables, including but not limited to past health, smoking and drinking status, pre-intervention exercise, medication use, and sick days taken. The differences were unchanged. Here's David Muller, another principal investigator of the study. If we had published only these observational analyses, the headline result could have been that even after controlling for a battery of confounding variables, participation in a wellness program was associated with a significant reduction in healthcare spending, an improvement in exercise, and a lower chance of ceasing employment. All of that would have led us astray. The wellness program appeared to cause none of those things. This doesn't mean that we should never believe the results of observational trials. Many show significant results that stand the test of time. But in every case, we need to weigh the possibility that the people who were studied were selected in a way that made them very different from those who weren't selected or the general population. This appears to be the case with those who participate in a wellness program. Of course, not everything can be studied by controlled trials. Sometimes they're unethical or too expensive, or the causal effects are too far downstream from the intervention to detect within the length of a study. Here's Damon Jones, another investigator of the study. It's important to note our results so far only cover the first year of the program. There's a chance we may see different patterns over the longer term as we continue to collect data. Observational research can be the best way to study population-level effects, and in those cases, many researchers are exploring new techniques like the use of regression discontinuity, a technique to create quasi-randomized groups for analysis. Still, randomized controlled trials remain much more reliable and useful than other types of studies. In our eagerness to point out their flaws, we shouldn't overlook their benefits. Do you like the show? Always helps if you like or subscribe right down there. And another good way for you to support the show is a subscription service called patreon.com, where you, the viewer, can directly support on anything you like $1 a month, more if you like, but if you don't want to, totally fine as well. Go to patreon.com/healthcaretrash to see how you can help. We'd especially like to thank our research associates, Joe Sevitz, Crafty Geek, and Jonathan Dunn, and of course, our Surgeon Admiral Sam. As always, go to hctmerch.com to pick up good healthcare triage merch, and my book, The Bad Food Bible, still on sale in stores.